there's no one magic pill. It's the whole way we treat our body, treat our mind. It's not the days in your life that matters. It's the life in your days that matters. So if every day is a good, fulfilling, satisfying day to you, by itself is important.
Hi, my name is Samara Mahindra and I am the founder of Carer, India's first integrative oncology platform. Unfortunately, when it comes to cancer, there are many misconceptions and fears associated with it. But cancer can be treated, healed, and prevented. In this episode today, I am extremely excited to introduce to you the pioneer of integrative medicine. This man, Dr. Gary Deng, who is the director of Integrative Medicine, Memorial Sloan Kettering Cancer Institute, is a phenomenal representative of a medical professional who has taken integrative oncology to mainstream medicine. In his institute, using clinical nutrition, physical therapy, and mind-body therapies, Dr. Gary Deng and the Integrative Institute in Sloan has changed the paradigm of the way cancer treatment is treated, managed, and prevented effectively. So it gives me great honor and pleasure and excitement today to introduce to India on the very first Integrative Oncology podcast, Dr. Gary Deng.
Thank you, Samara. Good to be here.
So Dr. Deng, to just start off, we would love to know a little bit about you and the work that you've done.
I am the medical director for the Integrative Medicine Center at Sloan Kettering Cancer Center in New York City. And the Cancer Center established Integrative Medicine service 23 years ago. That's when I don't think other cancer centers have a service like that. The whole idea is to provide patients not only cancer care in the form of drugs, chemotherapy, radiation, surgery, but also treat the patient as a whole person, especially the mind-body-spirit connection, lots of lifestyle changes, non-drug therapy, so that they not only have the best outcome, they also have the best experience in their journey to fight cancer. And I have been doing this for about 22 years, and we have grown our service now to a full-blown service with 6 medical doctors. I was the first medical doctor there, and 3 nurse practitioners, and about 20 research staff. So we do a lot of research as well. And nowadays, we become a full-fledged, fully integrated service in the whole cancer center, just like psychiatry, palliative care, or rehab. So in our institution, integrative medicine is part of the standard cancer care. Our mission and vision is to make integrative medicine part of standard care everywhere else.
That's so good to hear, Dr. Deng, because that's our mission as well. We have always stood forward in, advocating non-clinical therapies and making it a part of mainstream treatment for cancer all over India. So this leads me to my first question. Memorial Sloan Kettering being the leading hospital and institute in evidence-backed therapies and advancements in medicine, what kind of science supports integrative oncology? And what is out there today that's proving that using these different interventions along with mainstream treatment is resulting in improved patient outcomes?
So when we talk about integrative medicine, we mean we treat cancer patients as a whole, as a human being, in totality of multiple parts. So it's not just about attacking the cancer cells, right? So we use the framework of the cancer cells lives in an ecosystem, which is our body. And it interacts with the rest of the body, both in the nutrition front, immune system, angiogenesis. So everything we do to our body and to our mind can influence this environment, make the ecosystem less supportive to cancer cells and more hostile to them. And to change that, the solution, the answer doesn't come in this form of a pill. There's no one pill will do that. It's an overall lifestyle modification optimize our wellness. In terms of scientific evidence, in recent years, we have increasingly recognized the importance of this concept of ecosystem. Actually, Sloan Kettering last year received a large donation to study this ecosystem, because we now know cancer cells is not just about the gene mutation or the cell growth. It's about the environment they live in the body. And specifically, we know nutrients plays a huge role in either supporting cancer cells or make them not so happy. And the immune system, if you look at the more common recent therapeutic breakthrough, they all target the environment, like the immune therapy, right? That's a major breakthrough in the past 5-10 years. Also, a lot of these hormonal therapy for breast cancer, they're basically cutting off any growth factors stimulating the growth of the cells. And now there are even new therapy being developed so that chemotherapy drug can penetrate the tumor tissue, because there's some drug works very well in the test tube, but in the human body it doesn't work well, because the cancer cells build a castle around them. So the cancer cells, the chemo cannot go in. But if you break down this environment, make the environment more penetrable by chemo, you have better results. So there are a lot of this evidence generated in the last 5 to 10 years showing we have to treat cancer patients as a whole, not just targeting cancer cells themselves.
So you spoke about immunotherapy, and that's a very interesting topic. That's becoming more or less mainstream treatment, or we're moving in that direction when it comes to treating patients and treating cancer patients. There is a lot of evidence that's pointing towards the gut microbiome and your microbiota, and the healthiness or the the status of the microbiota and the effect that has on the response to immunotherapy treatment. Is there anything that you know about this and that supports this? These claims that the microbiome has an effect on the response to immunotherapy and how patients actually recover from the disease.
Definitely. So we talk about ecosystem, the cancer cell in the body interact with the rest of the body, but the human being, we also live in the ecosystem, right? Outside the environment, our physical environment, emotional environment, the people we interact with, and pollution, and so on. Inside, we also have an ecosystem. There are trillions of microbes, hundreds, if not thousands of species, lives on our skin, and most of them live in our gut. They play a huge role in our biological function. Number one, they will help us digest food, and they will convert some nutrients to something we need. Without these microbes, we call them microbiota or microbiome, we cannot absorb these essential nutrients. Also, in recent years, they found they interact with the immune cells in the gut system. The gut lining are full of immune cells because they are in contact with external foreign material all the time. And when you have a healthy microbiota, the immune system is more vigilant. And in a few years ago, there was a direct evidence. They have these mice with melanoma, and they give them immunotherapy, the most cutting-edge immunotherapy, PD-L1 antibodies, which won the Nobel Prize a couple of years ago. And they found if they fed the mice with a special kind of probiotics, specifically the bifidobacterium, the immunotherapy works twice as well. So it works more effectively. And then they analyzed the immune cell. They found there are more tumor-specific immune T cells being activated if you feed these mice this particular mixture of probiotics. Since then, other probiotics have been studied, and some also show similar effects. And in human being, they found actually the opposite. They found people who take probiotics every day, they actually have less response to immunotherapy. But people who eat a lot of fiber, like a plant-based diet, like a vegetarian diet, they have a better response to immunotherapy. So how do you reconcile these? I think it's very easy to reconcile these appearingly contradictory findings, because if you take probiotics every day, whatever in that capsule, there's so many of them, they'll overwhelm all the other microbes. So
Right.
you actually have a reduced microbiota diversity.
Wow.
So in the experiment, when they did the mice experiment, they fed the mice probiotics once a week, not every day. So I think for human, if you want to take probiotics, don't take it every day. Take it once or twice a week at most. Or better yet, eat a diverse diet with lots of fiber. Because these probiotics are only one, maybe three, five species of microbes. But if you eat a very balanced, diverse diet, you're going to have cultivated hundreds of species of healthy bacteria. So that's why nutrition is very important, not only in supporting our growth or creating the nutritional landscape for cancer cells, but also help the immune system. And on the other hand, there are also studies showing this microbiota may also play a role on our mental health, like
Yes.
depression, Alzheimer, because again, they are intimately involved in creating our metabolic landscape in the body, right? Because whatever the microbes generate in terms of nutrients, chemicals, influence not only our body, but also our mind.
So, what would you suggest would be the essential components of treating a cancer patient who is on immunotherapy? So, what kind of integrative therapies must most definitely be a part of the treatment protocol?
So for people on immunotherapy, we want them to have a robust immune system. Because the immunotherapy in themselves, they're antibodies, but they don't kill the cancer cells. What they do is they unmask the cancer cells so they can be recognized by our own immune system. But if you have a weak immune system to begin with, no matter how much they recognize it, they're not going to attack them. It's like they're the detectives that find the criminals, but if you don't have a strong police force, the criminal will still be running around, right? So how to cultivate a good immune system? There's no one magic pill. It's the whole way we treat our body, treat our mind. For one thing, nutrition. If you're deficient in nutrients, you're not going to have a robust immune system. Number two, stress. We know stress is a known immune suppressant. Stress hormone, cortisol. We use it to treat autoimmune disease because it suppresses immune system. And chronic stress make our immune system weaker. Lack of sleep or poor circadian rhythm. You need to go to bed at the same time, wake up at the same time. Make sure you don't accumulate a sleep debt. So all these are important. And diet in the form of fiber. As I said, the current evidence shows a high fiber, very diverse fiber diet would be very good for a healthy microbiota. Down the road, maybe in 5 years, we find other ways of improving our immune system. But so far, one last thing is the exercise.
Yes.
Regular, moderate exercise really can make our immune system very robust. So if you look at it, immune system is a reflection of the overall state of our body, of our wellness. If you're well, you're in optimal health, you are going to have a robust, balanced immune system. Because you also don't want your immune system to be in hyperdrive, because then you've got autoimmune disease, right? The immune system starts to attack yourself, which is not what we want. So the solution for a strong immune system is really simple. Just take good care of our body with a healthy lifestyle and a healthy diet, exercise, stress management, and good sleep.
And there is, there's recent evidence that reports that a Western person's microbiome is very different to, say, an Eastern or someone in the Indian continent. So our microbiome is very different to maybe those who are in the US, right? How do we adapt to these changes? And as far as I know, the microbiome constantly and rapidly changes, and the treatment itself has a massive effect on the microbiome. So how do we respond and adapt to these changes?
First of all, I think the Indian diet is a very healthy diet. It's the plant-based, natural food rather than a lot of red meat, In the Western diet, lots of red meat, butter, animal fat, very little fiber, right? Very little vegetables. Vegetable, a lot of people think potato is a vegetable. It's actually not a vegetable. We're talking
Yes.
about fibrous, leafy vegetable. Um, so the Indian diet is a very healthy diet to begin with. I don't think people should change, but with industrialization of the society, fast food gets introduced, our food supply gets industrialized, and too much fertilizer, pesticides. In general, the diversity of our food decrease with industrialization, right? So if you think about the diet in the US, if you go into a supermarket, look at all the boxed food, they basically come from only a handful of things: corn, wheat, soy, sugar. All of them came from this. What I recommend our patients is, instead of just eating bread and rice, eat a variety of grains, whole grains, unprocessed grain, like millets, which I think in India is very,
Yes.
a lot of people eat that. That's a very healthy grain with a very balanced vitamin B profile, also a lot of fiber. Buckwheat, barley, oat, teff. So basically, do not eat just one kind of food, one kind of grain. Diversify your diet, which I think is what we promote to our US patients. I actually just wrote a cookbook that's published last 2 months ago by Fiden with 100 recipes. In that, we adhere to these principles. So for breakfast, instead of the regular U.S. patients would eat a breakfast of oatmeal and fried eggs, and we say, well, you don't have to eat oatmeal every day. You can have kasha, which is
Mhm.
buckwheat, you have millets, you can have barley, you can have other grains, and quinoa. So the idea is to diversify the diet, so the Western diet can become more like the Eastern or pre-industrialization agricultural society diet, which I think is healthy.
That's so interesting because you're absolutely right. When we look at we go down to the grassroots of the Indian diet, it's extremely healthy. It's full of anti inflammatory spices and herbs, and we use very good oils like coconut oil to cook with, and mustard seed oil. But unfortunately, we too are, moving a lot into the Western diet, and that's having a massive impact also on just development of cancer and increasing the risk of cancer, right? We're leading much more sedentary lifestyles. There's very high stress levels. There's a much larger population, Indian women who are moving into the working environment, and there are high levels of stress because they're, they are managing multiple things at once, running a home, bringing up children, trying to earn for their home and their family. So all of this is happening, and that's why we're seeing a huge, change in the way we live, our lifestyle, and then of course that's resulting in much higher levels of developing cancer, which is really unfortunate. And a lot of the times we just say, go back to the roots, go back to what's your regional grains and your, regional and seasonal fruits and vegetables, and literally start there, because there it doesn't require any fancy diets. So I'm going
Mhm.
to shift the focus a little bit on, more deeper towards integrative medicine. So, Kara, as you know, we focus a lot on quality of life, improvement in response to treatment, and also treatment adherence. I wanted to ask you what your perspective was on, adhering to treatment protocols. This is a huge problem that we're facing in India and probably globally. And I'm not sure if this translates to the Western world, but over here in India, there's a very strong Ayurvedic culture and natural medicine culture. And while that's, it's phenomenal in its own right, the perception of allopathic treatment is quite negative. So when a patient starts feeling better, there is a high dropout rate or there is a delayed treatment. Clubbed with the fact that if a patient is on treatment and they're unable to manage it effectively because it's just lack of information, there is a low adherence to sticking to the treatment protocol. So there are multiple factors. I believe over here it starts with miseducation and the wrong perception of treatment. But what, in your mind, are the major factors that affect treatment adherence, and what can we do as integrative specialists to improve the duration of therapy or having a patient stick to treatment regimens?
I think the first step will be education, patient education, right? Because a lot of our patients are not familiar with this so-called evidence pyramid or evidence base. So they sometimes rely on individual cases. Uncle of mine did this herb and the cancer went
Yes.
away. But we'll ask how many. Number one, did your uncle also get other treatments? So how do we know that's the only reason he had a great response? Secondly, did you treat 10 patients to see one case, or did you treat 1,000 patients to see one case? So we have to look at the percentage of response. And that concept is not always how our patients think. So I think education on how to evaluate or critical thinking and how to evaluate claims or ideas or opinions independently. And that can be tough because that goes kind of counterintuitive against people's usual way of thinking. But I think that's the fundamental solution. It's the education of how to look at evidence in totality and look at whether there's any control group and whether the effect you see can be attributed to the treatment. And secondly, if we make the Western or allopathic medicine treatment more humane or more gentle to our patients by reducing some of the side effects, they may be more likely to adhere to it. Because one of the common reasons people stop chemotherapy is they have side effects that are too hard on them. And if we can use natural therapy, lifestyle changes to reduce that, they will become more compliant and become more successful in their treatment. One example is a lot of breast cancer survivors, they use hormone treatment, right? Aromatase inhibitor to block the effect of the production of estrogen in the body that fuels the growth of breast cancer cells. But a high percentage of these patients have side effects like joint pain, hot flushes, insomnia, weight gain. Some of them are so severe they just stop the aromatase inhibitor. But we know aromatase inhibitor will cut your recurrence rate by half. So instead of 40% recurrence rate in 5 years, you now get only 20%. Or instead of 10%, you get 5%. So if they stop the aromatase inhibitor prematurely, they are taking on risk for recurrence. So what we do is we give them these more natural therapies. For example, acupuncture helps with hot flushes. And for joint pain, we sometimes use something from Ayurvedic medicine like curcumin, boswellia, frankincense, that we're sure would not interact with their hormone treatment, because some herbs are so-called detox herbs. They will remove the drug out of your system. Then you may have less side effects, but also less effect. But in this case, we look at all the literature studying the interaction between curcumin or boswellia with other drugs, and we feel confident they would not have a significant interaction. So patients have less joint pain, less hot flashes, and then we teach them stress management technique, dietary changes so they don't make weight gain. So once these symptoms are down, they're more likely to stay with aromatase inhibitor, and their long-term outcome will be improved.
Great. The world is changed post COVID, and we personally have seen such a huge shift in, just the general population being very acceptable of, taking health as their first priority. Just the rate of health checkups, annual health checkups in India was abysmally low, and that's exponentially grown just after COVID. and then of course translating to the disease segment and those who are unwell and who are probably going through cancer. So a lot of patients are now coming on board, and they don't just follow what the oncologist tells them blindly anymore. They understand that there is a treatment protocol, but they want to be involved in their cancer journey. They want to know what they can do to improve their outcomes, make sure their quality of life is not hindered to a great degree. And so there's a lot of patient centricity that's taking place. According to you, what is patient centricity, and how are you moving in that direction in Sloan?
So patient-centered care has always been one of our emphasis. So by patient-centered care, we mean we treat our patients as a human being who happen to have some tumor cells in their body, rather than a pathological molecular mutation and so on. So when we treat patients like that, we have to take into consideration the patient's preference and their value system. One example is sometimes you say, well, you have pancreatic cancer, we give you chemotherapy. Without chemotherapy, you have 6 months to live. With chemotherapy, maybe 9 months. There are patients who said, well, give it to me. Give me the hardest therapy ever so I can live a few extra months so I can see my grandkids graduate. There are patients who also say, well, I'd rather have 6 good months than 9 bad months. So every one of us, the value system, what we treasure in life and our life priorities are different. And we cannot just give them a cookie cutter therapy. So, oh, pancreatic cancer, FOLFIRINOX. That's what I said. That's what you have to do. No, patients is the master of their body and their life. Their opinion, their preference, and their priority needs to be respected. On the other hand, sometimes they may have some misconception. We offer our professional opinion, try to correct that. But at the end of the day, if they do not take our opinions, it's their body. So we call it patient autonomy. So in that case, so-called patient-centered care or patient centrality means we treat them as a human being. In another word, just I always say I, when I talk to our residents, I said just treat them like your family member, right? If you have a family member just like this patient, is that the therapy you're going to give them? Is that how hard you're going to push the therapy? Or you say, well, I know my aunt, she'd rather do this and that, so I respect her wishes. So that's what we mean by patient-centeredness. The treatment has to be formed by the combination of scientific evidence, patient's preference and value and priority, and also our clinical judgment. Sometimes there's not enough evidence for us to say, oh, definitely there is a randomized controlled, placebo-controlled trial showing this is better than the other. In that case, actually, in the majority of our clinical scenarios, there is not enough evidence. We have to make a judgment call based on our experience, our understanding of the disease, and our understanding of humanity and the human being in front of us.
Mhm. And Dr. Deng, that reminds me when you had the opportunity to come to India and you met all our doctors and hospitals and our team. And I remember you telling my team specifically that while we use various different quantitative assessment reporting tools, qualitative assessments are very important. And just asking the patient how they feel and, really listening to their answers and what they're saying, the nuances in their responses can give us so much insight into what's actually going on, which could be much richer data for us than just doing, a quick survey or an assessment. So I remember you telling me that, and that's really changed the way we also interact with patients. And because we have such strong touch points with patients, we follow very strong, quantitative assessments, which gives us a roadmap, but the qualitative ones are the ones that are the true essence of really understanding from a psychological, physical, nutritional, behavioral standpoint of what's going on with that patient at that point in time. So I remember you doing that. Just one or two more questions. This is very important because while we all want to, make integrative therapy and integrative medicine a part of mainstream treatment, and that's what we are also really advocating in India. There is still a very misaligned connotation with these are supportive therapies that are nice to have, and maybe if I have the extra money, I will invest in these therapies. But most important is the treatment. And so that made us really focus on trials and data that we showed to you as well. And we've become much richer in the kind of data that we gather today. So patient reported outcomes and data analytics and data sets that we are collecting as the patient goes through the treatment protocol and as they use and implement integrative therapies. Can you speak a little bit about that and about how we can retrieve data and actually showcase how these integrative therapies have a very profound impact on the outcome of the patient?
So I think you mentioned about quality of life patient-centered evaluation, and there's many ways of doing that. So you have documented solid data. The simplest is just something called the distress meter, right? It's just from 0 to 1. How much distress are you in?
Right.
If you don't have time, you can use that. And then you can also track that to see how your patient is doing over time. The more sophisticated and complex system is called the PROMIS, PROMIS.
Yes.
This is developed by the National Institute of Health through a very elaborate, rigorous process. Everything's validated using behavior science methodology. So that would be good. And in terms of some patients or some part of the patient care team do not see quality of life as important as treating the tumor, shrinking the tumor. I think it's more appreciation of the quality of life rather than the quantity of life. I would say there is a saying, it's not the days in your life that matters, it's the life in your days that matters. So if every day is a good, fulfilling, satisfying day to you, by itself is important. Quality has a quality of itself, right? It's not just the quantity of life, but also the quality of life. I think as people getting more and more familiarized with cancer treatment, and they will start to appreciate that, both from the patient standpoint and also from the healthcare professional standpoint. And the other thing would be, I have seen doctors who would change their mind profoundly after their family member or themselves got sick, because now they're in the patient's shoe.
Yes.
And the things they used to think is very important, actually from the patient's standpoint, is not that important. They have a different priority. So I think this also needs to be in medical education. The medical students and residents should learn about these things early in their life or in their medical career, that we're treating human beings. It's not just about shrinking the tumor, extending their days, but also making sure their days are good days. And we try to do our part, like training residents, medical students, but this is a long process, right? Because it's hard to deprogram something that's been programmed for decades, but we still do our part. So I congratulate you. I really respect what you're doing there. You're in your group, you're helping the patients and helping the healthcare professionals to incorporate this part into their oncology care.
No, thank you so much, Dr. Deng. And can you quickly tell us what Memorial Sloan is doing today, and what are the new advancements in integrative oncology happening there?
We do a lot of clinical trials because for our oncology colleagues who are not familiar with integrative medicine approach to health, we need to generate and disseminate evidence. So we currently have 6 large randomized controlled trials, mostly on acupuncture, because it's very easy to do randomized controlled trial on acupuncture, and also yoga. So those are the 2 we're doing. We also have herbal medicine trials, either topical agent for pain, or we're thinking about oral agent for constipation, diarrhea, some of the common side effects in patients getting chemotherapy. So we do a lot of research, and we also do a lot of educational activity, and we educate a lot of, we call them APPs, advanced practice providers, which are nurse practitioners, physician assistants, because they are, or nurses, they have very close contact with patients. We teach them some basic things they can provide. And another thing we're working on, we started is make a lot of things online, triggered by the pandemic, but it also make it what we provide, all the classes, diet, exercise, stress management, more accessible. So we have a subscription membership program that people can take all the classes offered online every day. So this would be very helpful. Again, we try to spread the message so other cancer center, other hospital will start to incorporate what we have been doing.
That's fantastic. And to end, as you are a pioneer in integrative medicine and, of course, well respected amongst the medical community, anything that you would like to share with healthcare practitioners over here, the medical institutes, and those in the medical oncology domain, for them to understand how important integrative medicine is?
I think I come from the Western medicine training and experience. As I see more and more patients, I start to recognize the importance of the holistic care. And I think for my colleagues who are not familiar with this, I suggest you have some taste of it to learn it. The way we usually start with our colleagues in our cancer center is in employee wellness, because everyone in the healthcare professional is under a lot of stress. They don't have enough sleep, and they don't take good care of themselves. Then they feel tired, they feel burnout, they feel depressed. So we offer a lot of integrative medicine therapy to them. So instead of taking a benzodiazepine pill like Valium, now we teach you techniques to reduce stress. And once they see themselves the benefit that comes in a natural form, they will start to register in their mind and offer that to their patient. And we find that's the best way to make them have a taste and also start to say, wow, this is important. This is important to our life, not just our medical care, but also our life in general.
That's fantastic. I think our doctors in India most definitely require and deserve that. And that's something that I will take home, and let's see if we can offer something like this to all our phenomenal oncologists in the country. Thank you so much. It's always such a pleasure to connect with you. Thank you for giving us this time. Seeing you after post-COVID, after a couple of years. And as we were discussing before, the world has changed, but you look exactly the same. And that's the most important part. So thank you.
It's my pleasure, and I wish you the best in your very meaningful work. And I look forward to seeing you all again soon.
We hope you enjoyed this episode and found it useful for yourself. For more such episodes, please subscribe to our YouTube channel, Apple Podcasts, Spotify, and Eplog Media website, where we dive deeper into the world of integrative oncology and healing cancer the right way.